Well, what I want to share is we were of course engaged in the first round of Obamacare, and I think we had some moderate success the first time around. There was startup issues. We didn't get going until just up to the start date of October 1. And then we were engaged 6 months, and then there was the special enrollment extension in a month. So I think through that first round we learned a lot of lessons. Some of the lessons had to do with some real technical areas, like how do you reach folks, what's the best message to give folks. There was, as you recall, there was a lot of issues with the website, and we had to do a lot of workarounds because of that. We also learned, I think, that first round that we had, that the population that we were targeting were mixed households, mixed status status households. And those mixed status households consisted of legally present folks that had green cards, immigrants, and those that didn't. And so within a household you could have several members that were here, that were documented, and there several that were undocumented. So even though the standard was it should take an hour and a half, what we learned was, because of the website, it was taking much longer, and because we had these complex family situations where you had mixed status households, it was taking even longer. So a typical enrollment might last 2.5 hours, and even then we wouldn't complete it because the website would crash. We'd have to follow up. So there was a lot of starting and stopping, and I think that that really didn't help our ability to sign up as many people as we would have liked. The other thing was there wasn't a lot of resources in the first round. We were one of the few organizations doing this work in Travis County. And Travis County today has over 210,000 uninsured. About half of those are undocumented immigrants. So about 100,000 of the 210,000 are undocumented immigrants that would not qualify for the marketplace for insurance. So not only are we dealing with the second round with folks that qualify for the marketplace, we're also dealing with people that are undocumented that we also have to help, because we have a no wrong door approach here. So if you apply for insurance, we're of course going to try to get you in the insurance marketplace, Medicaid, and public insurance assistance programs. But if you don't qualify for those, then we try to make sure that you get that we navigate you to a program that can help you. Some of those are going to be nonprofit entities. Some of them will be federal qualified health centers, and so we spend a lot of time with folks making sure they get coverage one way or the other. Now the other 100,000 of that 210,000, about half of those were what I call the hard to reach populations, those folks that live in very low income areas that have a lot of issues of being disenfranchised, poor, don't speak English, and so we luckily from this first round we were able to bring back a lot of the same staff that had a lot of experience working with us and doing this kind of work. So we're able to really make some headway this time around. Now the other challenge this time was that there was one half the time period. Last year was 6 months, extended to 7 months. This time we only had 90 days. So not only do we have the new enrollees, but we had to re-enroll other folks that had gotten notices that their rates were going up in some cases, and in some cases they just didn't quite understand why their rates were being more expensive, or their coverage benefits were changing. So we had to basically help that re-enrollment process too. All this to say that I think we had a very good 3 months. We're still at it even today. Today they called for a special enrollment period for those folks they got a tax penalty last year of $95. This year it's $695, excuse me. And so if you got a penalty last year and you still didn't enroll this year, you're going to get another penalty, which is really even higher. And so those folks have a big incentive to enroll. So the enrollment will be from March 15th to April 15th, and we're looking forward to doing that as well. So just to wrap this up, so I think we I'm looking at the numbers stuff. I think we caused or helped to enroll about 8,000 people, which for us is a really big deal, because last year I think it was maybe 1/3 of that amount. So we almost tripled the amount of enrollment that we did, or cost to enroll. When I say cause, we did a lot of outreach as well, and a lot of those folks, went on to enroll on their own in some cases. So I'm just really proud of the staff that did all this work. I think we really have developed an expertise. We're using people that are from the community, that know the community, they're culturally competent. They're trusted advisors to a lot of the community people here. They're having great resources. They're influencers in the neighborhood. They can pick up the phone and call a church and say, we want to have your church hall to help us enroll. And they can make those things happen in a moment's notice. And those are just valuable resources for the community. So we look forward to continuing to do this work. It's so important. Access is what we're talking about here, access to healthcare. The other part of it is care. So I think part B of what we're going to be doing next is helping people access their insurance and make sure they can navigate through the healthcare system. And that'll be kind of the next stage of our work, starting, next week going forward.
We're going to do a take two, because what I can do is I can snip this because the phone rang. Sorry about that. So repeat again what we're going to do as a follow-up.
Okay. So we completed the enrollment process. The next step, and the enrollment relates to getting access to care. The other part of healthcare is not just accessing, but using the healthcare, the care coordination, and accessing that insurance policy, accessing the resources, the provider networks, and all that. So what we're going to be doing is the next part is helping people access their benefits and making sure that they know how to get to see a doctor, what their rights are in terms of the clinic, the patient bill of rights, and basically helping them navigate the healthcare system to get the care they need and coordinate that care with our community health workers.